Well, hello everybody, and this is another episode. I'd like to discuss the benefits of walking since I've been doing it for some time at the moment. I've been walking for very long distances, reaching up to 20,000 steps a day. Damn! Let us just start with a research paper that I had read. So this research paper actually studied the benefits of walking on the heart, the organ we have right here. I think it doesn't come as any surprise that many people nowadays don't walk enough. And we're seeing a rising population of obese people.
And non-obesity rates have more than doubled over the last 30 years.
Walking actually lowers the morbidity risk of heart diseases, and walking, unlike running and other aerobic exercises, is easy to do. Then you have walking also is easier to incorporate into a busy schedule. Benefits of walking and ways to encourage people to walk to help promote their health. Recent studies suggest that walking for 30 minutes a day, 5 days a week, which is equivalent to 150 minutes, actually reduced the risk of cardiovascular diseases by 19%. Another thing that they noticed is that the pace at which you walk. So if somebody walks in a very slow pattern, I'm sure you have friends who walk very slowly, and you have friends who seem to be tracking in front of it at a very fast speed as if they're running, but in fact they're walking. Those people who track faster are generally more healthy than men and women. And walking has been shown to be extremely powerful in reducing the risk of cardiovascular diseases in people who are the least to do so. So people who have sedentary lifestyles, people who are always at home having their potato chips and lying in bed. And the second group is the obese people, people who usually used active commuting, such as using the public transport, using bicycles. These people had generally better cardiovascular health, lipid levels, blood pressure was normal range, their insulin levels were well controlled. Then comes the meta-analysis that was actually used. This meta-analysis concentrated mainly on 2009 and early 2010. So the participants were asked to walk 20 to 60 minutes per day, at least 2 days to 5 days a week. They followed these people from 3 weeks to a year. The things that they used was the clinical biomarker and measurements and vital signs. They took the lipid levels and blood pressure, risk factors for developing cardiovascular disease. And walking, exercising aerobically actually reduced these things. It indirectly affects the risk of cardiovascular disease. And it was found that walking was an effective form of exercise for improving the health in older adults and those with existing heart disease. And walking also increased cardiovascular fitness. Resting blood pressures that were measured actually were reduced compared to the people who did not walk. And the blood pressure levels were significantly less, particularly in patients with hypertension, diagnosed hypertension which is high blood pressure, and in postmenopausal women. What is astonishing about this particular study is that previous studies has shown that aerobic exercise reduces the blood pressure. However, this is the first meta-analysis to show that low-intensity walking can actually have an effect on the blood pressure.
Good job.
And there are other health benefits, such as reduction in body mass, adiposity, and lipid profiles. Okay, so what are some ways for doctors and for the general public to help promote walking as a measure to reduce the risks of obesity and improve the cardiovascular disease? One way is through using pedometers. These pedometers are basically your Apple Watch. They count the steps. You want to aim for steps above 10,000 steps a day. However, nobody expects you to get from 0 or from 200 or from 1,000 to 10,000 overnight. So what you do is that you gradually increase the amount of steps. The other way is by promoting workforces and work offices and these telecommunication companies to send a message regularly every day. You can get your 10-minute walk. You can even divide these walking times. 10 minutes, 3 times a day to reach a total of 30 minutes a day. And then by the use of public transport. If your country promotes public transportation, then you can use those public transportations. And that's pretty much it. If you like the contents of this video, please subscribe here. And thank you for watching. Adios.